If you work in the retail or fast food industry or for municipal government or a charity, you may already be feeling the effects of the president's health care reform law. Tonight, Chief National Correspondent Jim Angle on the unintended consequences that are very real.
Small business accounts for some 2/3 of all new jobs, but that may be changing as they assess the burdens of Obamacare, which forces them to provide coverage if they employ more than 50 workers.
And not just any coverage, but a one-size-fits-all government-designed plan with specified essential benefits. And that will cost about twice as much as what many employers currently provide.
On top of that, we've seen literally almost 100% increase in the last decade, specifically for small business premiums going up. So how exactly does this law address this? It doesn't.
One way to avoid the burdens of the new law is to keep the workforce below 50 employees or limit workers' hours to less than 30 per week, which is defined as part-time, an incentive not to create more jobs.
Number one, it said don't hire. You don't want to get above 50. Number two, it said don't let them work more. You want to keep them part-time if at all possible.
And many businesses across the country are doing just that. 100 workers at Wendy's outlets in Omaha had their hours cut because the employer said he couldn't stay in business with the added cost of insurance. 50 full-time workers at Taco Bell's in Guthrie, Oklahoma were cut back to part-time. Some Papa John's pizza stores said they couldn't compete if they had to pay the cost of insurance. The same story for some Subway sandwich shops, Carl's Jr. and Hardee's. Cities, too. Cedar Falls, Iowa also cut hours, saying it couldn't afford health insurance either. Even nonprofits such as community colleges are cutting hours to avoid the cost of insurance, for which the government specifies generous benefits.
It will add $1.79 an hour every hour to the cost of hiring a full-time worker.
For small businesses, even dealing with the regulations about what must be covered and who counts toward the mandate is itself a financial burden.
They're paying about 36% more than their larger counterparts for compliance.
Only Washington could develop an employer mandate that reduces the likelihood that employers will offer on-the-job coverage.
The CEO of Whole Foods is so incensed, he referred to Obamacare as fascism, though he later pulled back.
It's very government controlled, and it's becoming more government controlled. So it's the opposite of free enterprise capitalism.
A regional Federal Reserve Bank recently asked small businesses what affects their hiring, and many pointed to the uncertainty under the new health care law as a major impediment. Brett?
Jim, thank you.